Alcohol, one of the oldest toxins known to man. Libacious, but toxic in certain cases. How does COVID-19 and alcohol come together? We're going to explore that in a moment because the literature shows that there's a big correlation and we're having some alcohol problems out there. So stay tuned. Let's learn more. Hello, I'm Dr. Oscar Hernandez, board certified internist and pediatrician. Today we're going to talk about something that's COVID related but not really COVID, and that's the rise that we see in alcohol use during the pandemic. The Lancet, which is a very prestigious medical journal, in October, earlier this month of this year, obviously 2020, the pandemic year, published an article showing that people who used to have problems with alcohol and have gotten better, and they're no longer abusing alcohol, there is a higher risk of relapse into alcoholism, and that people who weren't using alcohol before in dangerous quantities have started to use alcohol. Well, you have to ask yourself why. And the main reason is that alcohol for many people causes a sense of euphoria. In other words, it makes them feel good. It helps take the edge off stress. It makes them funny, laugh. Some people get violent. But most people in very moderate amounts, they're going to feel a little bit better about things, and it's kind of like an escape mechanism. So maybe not the healthiest escape mechanism, but that's why it's being used by a lot of people. Well, what are we seeing during the pandemic? We're seeing that the use of alcohol is going up, but not simply the use of alcohol, but rather what we call unhealthy alcohol use, or what the National Institutes of Health calls as a sister entity, alcohol use disorder. So when we see too much alcohol use, then we get into trouble. How much is too much alcohol? Well, it depends on your age and it depends on your sex. And so the way that the National Institutes of Health parse this out is they say if you're a male under 65 years of age and you're getting more than 14 drinks a week or more than 4 drinks a day, that puts you into unhealthy alcohol use or possibly alcohol use disorder. If you are over 65 years of age and you are a male, then it's 3 drinks a day or more than 7 drinks a week. Well, that's a big difference between under 65 and over 65 in terms of 14 drinks versus 7 drinks. If you're a woman, that same parameter benchmark applies. More than 3 drinks a day or more than 7 drinks a week puts you into a risky area. Now, why do we talk about this? I try not to talk about stuff that we can't do something about. And here's the good news. In September of 2020, the Mayo Clinic Proceedings publishes a very good review article of stuff that I've known for years, but it's always good to review it again. And that's the use of medications for alcohol use disorder or unhealthy alcohol use. By the way, if you yourself have any question about whether you have unhealthy alcohol use habits, or maybe there's a family member or a friend, then I would encourage you to go online and look for the Audit, AUDIT-C questionnaire. It's a very brief questionnaire. It's a screening instrument. It's not a diagnostic instrument. And it gives you a good idea of whether maybe you need to think a little bit more about your alcohol use. If the Audit-C questionnaire is suggestive of having problems with alcohol use, then you can also look up the Audit questionnaire, plain old Audit. It's a lengthier questionnaire. It's got more questions. It takes more time. And maybe if you do these things, take them into your doctor and show them to your doctor and say, hey doc, my wife complains or my husband complains that I drink too much, and they gave me this paper and I filled it out. This isn't an audit question, it's just paper I got on my desk. And they gave me, and this is what it showed. And hopefully your doctor has some concept of what this questionnaire is and how to use it. And if not, they'll look it up and they'll figure it out. This is not rocket science. And so the next step is you need help. Well, here's my analogy when it comes to helping treat alcohol use disorder or unhealthy alcohol use. It's an amphibious approach. It's not a one-size-fits-all. It's not a single answer. It's not here, let's throw you some medicines at you. Or here, let's just send you to counseling or go talk to your pastor about it. Remember, when it comes to alcohol use disorder, about 50% of alcohol use disorder has a very strong genetic component. The other 50% of alcohol use disorder has to do with the social environment you're in. And that's why pastoral care and counseling and 12-step programs and so on are very useful. So it's important to use an amphibious Normandy beach. We're storming the beach approach. We're going to hit it by air, land, and sea. What does that mean? If you're a person of faith, go to your church, talk to your pastor, get in touch with your spiritual roots. Even a 12-step Alcoholics Anonymous program that it may not be specifically faith-based talks about accessing a higher power. Gee, what could that be, right? So anyway, any 12-step program is useful. And then many churches offer something called Celebrating Recovery. And if you don't have this in your town or where you're listening to me, check out Celebrating Recovery. Just Google it up. And there are many churches and houses of faith and worship that will help you with this. And then there's your doctor. What can we do in terms of medicine? Well, there's a couple of medicines that are approved by the FDA. By the way, they're not new. They've been around like forever. Since the end of the 1940s, disulfiram has been on the market. Now, this medication is something that you have to take every day, and it makes you really feel terrible. If you drink, you're going to have problems with vomiting, nausea, redness of your face, and so on. So what happens to many people who have alcohol use disorder, they just don't take it. They'd rather take the alcohol. So it's a two-edged sword. It doesn't work fabulously well unless you take it. But boy, if you take it, you're going to get sick if you drink. In fact, we even tell patients to avoid rubbing alcohol or to avoid COVID-related hand sanitizer that is high in alcohol because they can get responses just from those very minimal exposures. Many cough medicines have some alcohol in them and cold remedies and so on. So that's one of the older ones. But then there are some of the newer ones. Medications that were approved in the early 2000s. And the one that I have a lot of experience with is naltrexone. Naltrexone is a medicine that blocks what we call mu, delta, and kappa receptors in the brain. What is a mu receptor? How interesting. A mu receptor is a receptor that is activated by opiates. You know, people who have opiate addictions, who maybe use too much Demerol or the OxyContins or the codeines of this world, those medications bind receptors in the brain that make you feel good. Hey, wait a second, what does that have to do with alcohol? Well, remember what I said at the beginning? Alcohol gives you a euphoric effect. Why? Because it also binds those receptors in the brain. Yes, those very same receptors. So naltrexone, a medicine that we use in people who have opiate and narcotic addictions, is the same medicine we use in patients who have alcohol use disorder. That's one of them. Now, it can be given once a day, and there's also a shot form that you just get once a month. If you drink, it doesn't make you vomit or anything. It's a great medicine for people who are heavy drinkers, who don't necessarily want to pledge abstinence yet, but who want to drink less. And we know that it's very useful in terms of that. The other thing that we know is very useful is a medication called acamprosate, also available since the 2000s. Nothing new here, but a lot of people don't get treatment because they don't know that there is medical treatment for alcohol use disorder or for unhealthy alcohol use. Acamprosate has a problem. It's a 3-time-a-day medicine, and it works best if you're taking it under supervision, kind of like disulfiram, because a lot of people don't like to take the disulfiram. Like I said, they'd rather go drink. And so what we want to do is be absolutely sure that you know that these medications are out there, and acamprosate is probably a better choice for people who are ready to absolutely stop, and the acamprosate should be given by people who are supervising you. How many people need to be treated for there to be efficacy of these medicines? Well, here's something that I haven't discussed on these programs before, and it's called NNT, number needed to treat. How many people do we need to give treatment for before we see one person respond to our treatment? Well, in the case of alcohol use disorder, no matter which of these medicines you use, the number is about 12. You say, well, doctor, that's terrible. That's useless medicine. You got to treat 12 people before one of them has a good response? Yep, that's the general number. But here's something you need to know. That number is actually better than the response that we have to use when we treat patients with aspirin to avoid a stroke. You have to treat about 50 of them with aspirin to avoid a stroke. So the number needed to treat there is 50. What about the use of antibiotics in otitis media? My kid has an ear infection. I got to rush him to the emergency. They need those antibiotics. How many of those kids do you need to treat with antibiotics before you see one that will respond? For every 16 that get rushed to the emergency room or urgent care, one of them will respond to antibiotics. How about the use of antihypertensive medications to avoid stroke? This is very important, right? People don't take their blood pressure medicine, they can get a brain bleed. It's about 60. So the point is this: when it comes to treating alcohol use disorder, using medications has an even better number to treat than some of these other things that we take for granted. Folks, if you don't believe these numbers, I'll be happy to send you the citation, info@metromedfl.com. What I'm telling you today comes either from The Lancet in October of 2020 or from the proceedings of the Mayo Clinic in September of 2020. That's all the time we have today. We'll be back again for the next version of these installments. If you liked us, you're going to give us a thumbs up. Send it to your friends, family. Sign up. If you don't sign up, you're not going to be getting them. And believe me, 2020 has been the year of medical wonderment. We've got so much going on that there's always something important to say. So we'll see you soon. Stay tuned.